I am Dr. Health Education. I've been talking about breastfeeding challenges that mothers face. I promised to talk about 15 challenges. I've talked about 4. So this is my 5th video on challenges that breastfeeding mothers face. So today I'm talking about a common one called nipple pain. You are feeling pain in your nipple. It's a challenge for some mothers in breastfeeding. So I'm going to talk about 3 causes from the baby's side that can cause pain for the mother in the nipple. And I will talk about 7 causes from the mother's side, because both can cause the problem. Both what the baby do and what the mothers do. Both of them can cause problem that can make the mother to have nipple pain. So let me start with the baby's side. The first one is tongue tie. I dedicated a video to that. Tongue tie may not allow a baby to be able to apply his mouth or her mouth to the mother's breast very well. So the baby may end up applying the mouth to the nipple. It is breastfeeding, not nipple feeding. The baby's mouth is supposed to apply to the breast, not to the nipple. The nipple is supposed to be inside the baby's mouth. The gum of the baby is supposed to apply to the breast. That's why we call it breastfeeding, not nipple feeding. So tongue tie is one of the reasons why the baby's mouth may not apply to the breast and will be applying to the nipple. And this can cause nipple pain for the mother. That's number 1. Then number 2 cause from the baby is the baby may not have tongue tie, but the mother may not know how to position the baby to the breast very well. And I dedicated a video to that. You can check my page. But like I just said now, it is breastfeeding, not nipple feeding. The mouth of the baby is supposed to apply to the breast. The areola, that dark area around the nipple, that's where the mouth of the baby is supposed to apply to. The nipple is supposed to be inside the mouth of the baby. So anything short of this will cause nipple pain for the mother. The third cause from the baby is when mothers pull their nipple out of the baby's mouth. It can cause pain for the nipple. What do I mean by this third cause from the baby? You know, when you have applied your baby to the breast very well and is sucking, and then you now want to stop the breastfeeding, you are not supposed to pull your breast out of the baby's mouth just like that, because you may end up leaving your nipple in the mouth of the baby, and the gum of the baby will just gum the nipple, and then it will cause pain for you. What you are supposed to do is this. Of course, you are supposed to wash your hand before you start breastfeeding. So what you are supposed to do is you take your 2 fingers, take it inside the mouth of your baby, and use it to like hang the gum, and then you remove your breast from the mouth. I don't know if you get that. What I mean by that is that when you take your 2 fingers inside the mouth, use the upper finger to stop the upper gum. Use the lower finger to stop the lower gum, and then remove your nipple in between them. And then the mouth will just clamp on the 2 fingers. Then you can now remove your 2 fingers. With this, the baby will not bite or gum your nipple. So those are the 3 usual causes from the baby's side. Now from the mother's side, the first reason why a mother can have nipple pain is breast engorgement. I dedicated a video to that too. You can check my page. Try as much as possible to make sure that your breast is not engorged. If it's engorged, press a little out of the milk. Use a warm compressor and so on. I dedicated a video to that, so you can watch it on my page. Then the second reason is what we call nipple thrush. Whenever mothers are breastfeeding, some of the nipple splay on some of the breast milk splay on their nipple. If they dry on it, they can cause what we call nipple thrush. It causes nipple pain. So what you should do is that anytime you finish breastfeeding your baby, use a small cloth, put it inside a clean water, and clean your nipple before you finally put your nipple pad and then put your wear your bra. So that is a second